Welcome. Today we're delving into nephrogenic systemic fibrosis, or NSF, a rare but serious condition that affects individuals with kidney disease. This debilitating illness involves the thickening and hardening of the skin and internal organs. Understanding NSF, its causes, and management is crucial for both patients and healthcare professionals. NSF is almost exclusively linked to exposure to gadolinium-based contrast agents or GBCAs. These agents are used during magnetic resonance imaging or MRI scans to enhance the clarity of images. In individuals with impaired kidney function, the body struggles to eliminate gadolinium effectively. This retained gadolinium triggers a cascade of events, ultimately leading to the development of NSF. It's important to note that not all GBCA agents carry the same risk. Some are considered higher risk than others. The exact mechanisms behind NSF are still under investigation, but the prevailing theory involves the prolonged retention of gadolinium in the body. This retained gadolinium stimulates immune cells, particularly fibrocytes, to proliferate and deposit excessive amounts of collagen in the skin and other tissues. This overproduction of collagen results in the characteristic thickening and hardening observed in NSF patients. Furthermore, gadolinium might directly affect fibroblasts, the cells responsible for collagen production, further contributing to the fibrotic process. NSF is a relatively rare condition. Its incidence increased significantly in the early 2000s as the use of GBCAs expanded before awareness and guidelines were put in place. Individuals with acute kidney injury, chronic kidney disease, or those undergoing dialysis are at the highest risk. Since the implementation of stricter guidelines regarding GBCA use in patients with kidney disease, the incidence of NSF has significantly declined. However, it remains a concern, especially in those with severe renal impairment. The signs and symptoms of NSF can vary widely, but they typically involve the skin. Common symptoms include thickening and hardening of the skin, often starting in the extremities like the hands and feet. This thickening can lead to skin tightening, restricting joint movement, and causing pain. Other symptoms may include burning, itching, and swelling. In severe cases, NSF can affect internal organs, causing fibrosis of the lungs, heart, and muscles. This can lead to breathing difficulties, heart failure, and muscle weakness. Diagnosing NSF can be challenging due to its rarity and the variability in symptoms. A thorough medical history, including any prior exposure to GBCAs and a history of kidney disease, is essential. A skin biopsy is often performed to confirm the diagnosis. The biopsy will reveal characteristic changes in the skin, including increased collagen deposition and the presence of fibrocytes. Imaging studies, such as MRI, may also be used to assess the extent of internal organ involvement. It's important to differentiate NSF from other conditions that cause skin thickening and fibrosis. There isn't a widely accepted classification system for NSF based on severity. However, clinicians generally categorize cases based on the extent of skin involvement and the presence of internal organ involvement. Some patients may have limited skin changes, while others experience widespread fibrosis affecting multiple organs. The severity of symptoms and the impact on quality of life are also used to assess the overall condition of the patient. There is currently no cure for NSF, and treatment focuses on managing symptoms and slowing disease progression. Physical therapy and occupational therapy can help maintain joint mobility and prevent contractures. Topical corticosteroids can alleviate skin itching and dryness. In some cases, systemic therapies such as corticosteroids, pentoxifylline, and thiosulfate have been used, although their effectiveness varies. Renal transplantation has been shown to improve NSF in some patients. More recently, immune-modulating therapies are being explored, but further research is needed. Prevention is the most effective strategy for combating NSF. This involves carefully screening patients for kidney disease before administering GBCAs. Clinicians should use the lowest possible dose of GBCAs when necessary and avoid using higher risk agents in patients with impaired kidney function. Alternative imaging modalities, such as ultrasound or non-contrast MRI, should be considered whenever possible. Patients with kidney disease should be educated about the risks of GBCAs and the importance of informing their healthcare providers about their kidney condition. The prognosis for NSF varies depending on the severity of the condition and the extent of organ involvement. Some patients experience relatively mild symptoms that can be managed with supportive care. Others may experience progressive fibrosis that significantly impacts their quality of life. Recent research is focusing on understanding the underlying mechanisms of NSF and developing more effective treatments. Studies are investigating the role of specific immune cells and signaling pathways in the fibrotic process. Emerging therapies, such as antifibrotic agents and immune-modulating drugs, are being evaluated in clinical trials. Continued research holds promise for improving the outcomes for patients with NSF.